Hi, I'm Walter Gamboa, and my two topics are myocardial infarction, known as heart attack, and common cold. Myocardial infarction, known as heart attack, is a medical emergency where the heart muscle begins to die because the body isn't getting enough blood flow. And this is caused by a blockage in the arteries that supply blood to the heart, which is due to atherosclerosis. It's a buildup of fats, cholesterol, and other substances in the artery wall. So without blood flow, the affected heart muscle will begin to die. Other conditions that disrupt this rhythm of the heart and cause cardiac arrest are the coronary heart disease, congestive heart failure, cardiomyopathy, and ventricular fibrillation. The heart muscle can have permanent heart damage and possibly death if the blood flow is not back quickly. So if you see someone on the ground with no pulse and not breathing, get someone to call 911 and get an AED. Start chest compression right away until the person starts moving or breathing, or when someone brings an AED or EMS arrives. Symptoms are chest pain, chest pressure, tightness, discomfort that radiates to the arm, jaw, and back, shortness of breath, sweating, nausea, vomiting, and dizziness. Here you can see some pictures of the heart, the buildup of the plaques, and the not letting the blood flow and buildup of blood clots. Here you can see the blood not going in this part of the heart, causing this part of the heart tissue to die, affecting the heart to not pump efficiently the blood throughout the body. On these two pictures, we'll see compressions. So the compression acts as a pump, pumping blood that will go through the brain to the lungs, any vital organs. And the compressions are 100 to 120 compressions per minute and a 2-inch depth when you're doing the compressions. Massage and myocardial infarction heart attack. So when you do a massage on somebody, ask when the myocardial infarction occurred and how well is the recovery going. If the myocardial infarction was recently and the client is frail, only apply light pressure at 3 out of 10 on the pressure scale. If the client is farther along in the recovery and has completely recovered, a massage is indicated. And also make sure the client has their own medication, such as the nitroglycerin, because once a patient had a history of myocardial infarction, they can get a second one or get another myocardial infarction in the future. So it's very important for them to have the medication. My other topic is common cold. This is known as head cold, infectious rhinitis, and upper respiratory infection. Viral infection of the upper respiratory tract is highly contagious during the onset of symptoms, 1 to 3 days, and then become less contagious. Most common lasts for 7 to 10 days. Other infection can occur with common cold, infection of the middle ear, sinuses, and the lungs. The virus can spread through airborne droplets or contact with contaminated objects, such as utensils, plates, cups. Some of the symptoms are runny nose, sore throat, cough, sneezing, fatigue, low-grade fever, headaches, and body aches. Treatment, prevention, and massage. So getting plenty of rest, drinking fluids to stay hydrated, using a humidifier or nasal spray or drops, or the counter cold or cough medicine. So wash your hands frequently, avoid touching your nose, eyes, mouth, and cover your cough and sneezes, and avoid sharing personal items such as utensils, drinks, and towel. And usually massage is postponed until the client is no longer ill, and usually takes about 5 days from the onset of signs and symptoms. That's my presentation. Thank you.